Hi everyone, this is Paul from OrthoEvalPal. What I want to talk about today is how I like to treat cervical spine facet syndrome. This is a fairly uncommon issue, but when you see it, they're very devastating, they're very painful and limiting. What is facet syndrome? It's an irritation of the joints that help to support the neck, and the inside of the joint could be irritated. You could get this from arthritis. You can get this from a sudden turn or twist, and the soft tissue, the capsule around that joint, becomes inflamed and irritated. As a result, you get a significant amount of spasm and localized pain, usually around that spot in the neck. Different than having a nerve root that's being pinched and causing pain going down the arm, this usually stays quite local. People who have facet syndrome don't like to tilt their head to the side of the problem, and they don't like to extend the neck, because what happens is it causes a pinch to that facet. So what I like to do with folks who have that, sometimes I'll do a little heat, some deep ultrasound to that area, but manually I will try to open up that joint a little bit and do some nice manual traction. Sometimes I'll put them into a mechanical traction device to help just keep a nice low load stretch and open up that joint a little bit. One of the other things I like to do that I find very beneficial is rhythmic rocking to the opposite side. Okay, so what I want to do is try to get that spasm to relax, and we know that rhythmic rocking neurologically can just kind of relax those muscles. So what I'll do is I'll take the patient and I'll really get them to relax here, and then I will rotate and flex them to the opposite side. So I totally avoid closing that side. I go to the opposite side and I start with a nice gentle rotation just like this, very relaxing. And then I will try to maybe flex them a little bit more and come up toward neutral. I don't let them get so far back that they get impinged. And I kind of slowly work my way over toward the painful side. Now, if they get discomfort, let's say here, I'll back off and I'll avoid that range and just work on this opposite side. And what this does, it helps to open up that facet joint. It helps to mobilize that synovial capsule a little bit to allow it to move better. And it also helps to relax the surrounding soft tissue, so there isn't so much spasm in that area, maintaining so much tightness, because these really respond well. Typically within a week, these are significantly better, but you can make them better by just doing a little rhythmic rocking here to the opposite side and not irritate it. One of the things that people with facet problems do is they keep trying to see if it causes an irritation when they look to that side, and we tell people stop doing that, don't irritate it, just let it come along on its own, and they typically do. These generally will get better conservatively. Folks, thanks a lot for watching. If you like our video, make sure that you give us a thumbs up, and be sure to subscribe so that and hit the notification bell so that you know every time we have a new video that comes out, you'll be the first to watch it. Thanks.